Hi everyone, welcome to PHARMA Overview. Today's video is about Respiratory Syncytial Virus RSV. Respiratory Syncytial Virus cases are more common as flu at the beginning in the fall and also during colder months when we are indoors together. Now many parents have more concern about RSV and what is this virus and is their child at risk. So in this overview, I'm talking about its symptoms, treatment and when to seek the medical care. And having RSV may lower the immunity and also increases the risk of getting COVID for kids and adults. Respiratory syncytial virus infection is a seasonal lung infection. It causes the infection in lungs and also the respiratory tract. It is highly contagious and the symptoms are mild and mimic the common cold. It mostly affecting the babies of 12 months, premature infants, older adults, children with lung and heart diseases and also the immunocompromised patients. And the infection most commonly appear in 4 to 6 days after the exposure of the virus. And most of the children and adults recover in 1 or 2 weeks. But some remain contagious for as long as 4 weeks. Primary symptoms of the respiratory syncytial virus infection are runny nose, dry cough, low-grade fever, sore throat, headache, sneezing and loss of appetite. And for severe cases, the symptoms are bronchiolitis and pneumonia. And consult the healthcare provider if your child having these symptoms like short, shallow and rapid breathing, flaring of the nostrils with each breath, belly breathing, bluish color of the skin, lips and nails, and also the wheezing. And complications are hospitalization is needed if they are showing the severe symptoms, and other complications include pneumonia, middle ear infections, asthma and repeated infections. Home remedies to relieve the primary symptoms are create moist air to breathe and manage the fever and pain by using analgesics and antipyretics, and give the nasal saline drops to clear the stuffy nose, and drink enough water to manage the dehydration and stay away from smoke, and consult the healthcare provider before giving the OTC cold medicines. And viruses are transmitted through the eyes, nose or mouth through nasopharyngeal secretions or direct contact with the virus. Healthcare provider can do the primary diagnosing from wheezing or listening to the abnormal sounds. And other diagnosing tests are blood count checking, antigen test or PCR. And the US FDA recently authorized emergency use of a direct-to-consumer 3-in-1 home test, and that can determine whether the patient having the flu, COVID-19 or RSV infection. And you swab your nose to collect the sample and send it to the lab for PCR analysis. And the severe complications can be identified through X-ray or CT scan. That is the main diagnostic technique. And the pulse oximetry can be done to check the oxygen levels. Preventive measures from respiratory syncytial virus. Cover your coughs and sneezes with a tissue or your upper shirt sleeve, not your hands. And wash your hands often with soap and water for at least 20 seconds. And if soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Avoid close contact such as kissing, shaking hands, and sharing cups and eating utensils with others. And clean frequently touched surfaces such as doorknobs and mobile devices. And if you are prone to sickness or have a weakened immune system, stay away from the larger crowds of people. About treatment, unfortunately no specific treatment, only self-care and supportive care can be given. The US FDA had approved one drug to treat severe lung infections caused by RSV, It's an antiviral drug called ribavirin. And the drawback is that it is having ADR including rash and chest pain. And the drug palivizumab injection given as a prophylaxis to prevent severe RSV illness in certain infants and children who are at high risk of severe disease. And antibiotics can be given if there is any bacterial complications like pneumonia. Currently, no licensed vaccines are available, but dozens of vaccines are in the last phase of clinical trials. Hope it will launch soon. So that's about the details of respiratory syncytial virus, its infections, and about the treatment. If you like this video, do share, comment, and subscribe. Thank you for watching PHARMA Overview. Bye.